It's your favorite time, question and answers. Well, it's at least my favorite time. I don't know about you. But in this episode of Healthcare Hacks, I'm going to answer a couple questions that we received from human resource professionals. So if you want to know more about what you need to think about if you're changing health plans or short-term disability, this is the episode for you. Hi, my name's John. I'm your healthcare hacker, and I like to answer questions. Before we get started today, please take a minute and feed the algorithm. Like this video, comment on it, follow Athos Health on your favorite social media platform. We're on them all. That way, we can reach as many people as possible to get our hacks out and help them navigate what is a very complex U.S. healthcare system. All right, let's just jump right into the questions. We have two this month. The first one comes from Tom from Maple Grove, Minnesota. And Tom asks, my company's changing its insurance plan this year, and I want to make sure that the employees have a wonderful experience. What information do I need to share and focus on? Well, that's a great question, Tom. And I really think of it this way. There's the basics, right? So how's the deductible change, out-of-pocket max, etc. Now, oftentimes, that's covered pretty well in the handouts that are given by the insurance company during open enrollment. However, there's a couple areas where I think you need to stress a little bit more around what's changed and more importantly, how does the employee get their arms around it? The first is the network. If you're changing health plans, the network is probably changing. So you should make sure that they understand how to check if their doctor is in network, and if not, how they can find a doctor that is. And it's not just doctors. A lot of times pharmacies change too. I can't tell you how many times I've had someone call me and say, hey, my pharmacy is no longer in network. I've gone there for years. So give the employee the information so they know how to check it and see, if they need to make a change and where they go for services. The second thing I make sure I try to communicate to employees is around authorizations. A lot of health plans have different services that require authorizations. Now, it can be a long, daunting list, so I wouldn't necessarily communicate the whole list, but again, it's about communicating the process. Oftentimes it's things that are outpatient procedures or surgeries, and letting the employee know how they can check, whether it's on the portal or giving a call to the insurance company to make sure that their service is covered. Because the last thing you want to do is switch insurance companies, have someone have a surgery a week or two after you switch and not be covered because there's no prior authorization. So give the employees that information just so they can really understand what's going on and what they need to check to make sure that their service is covered. The final area is around anything that's special. If you got an HSA, HRA, etc. I spend a little bit of extra time there because again, that's a complicated topic that a lot of employees just don't understand or don't have a lot of exposure to. So during open enrollment, I'd make sure I'd really talk to my employees around what's changed if you're adding an HRA or funding an HSA, what that looks like, what it means for them, and how do they use it. The second question comes from Lisa from North Andover, Massachusetts. Lisa asks, I've noticed a lot of our employees that have had to use short-term disability have had their claims denied recently. What's going on? Why does this happen? Well, Lisa, short-term disability is really almost like medical when it comes to denials. A lot of time, the denial has to do with the documentation that the provider is giving to the insurance company or those details that just aren't being connected. So what I would tell your employees, if they're going for a short-term disability claim and it's been denied, is the key person they need to work with is their provider. Because what's probably happened is the provider hasn't provided enough information or much detail to support their claim. So I would advise you to tell your employees, first call the insurance company, understand exactly why it was denied, and then have a conversation with the provider to make sure that they can give the correct and complete information to the insurance company to give them the best opportunity to have that claim accepted and get the short-term disability coverage that they need. All right, well, if you have any questions, please leave them below. Like I said, I love to answer questions, whether it's about this topic or any other. Just leave them, and we'll get to them in a future episode of Healthcare Hacks. And as always, make sure you get the facts by joining me in the next episode of Healthcare Hacks.